So right now we're switching gears, and we are going to do the hair growth, and the struggle is real. I'm going to go to the hair and scalp. So about 60% of the population is suffering with hair loss or hair, a sparsity of hair. And basically there's a lot of factors for it. But we normally, the cause of it is DHT, which is dehydrotestosterone. And what we have found, or what through studies, is microneedling, just like it's really corrected for the skin with cytokine enhancement and VEGF, which is the vascular endothelial growth factor, it does the same for the scalp. So what the lovely Sigal is doing right here is we're working in, Dermaroller has an Accelerus brand for growth for hair growth, and what it is, it's a cocktail of ingredients which all have DHT, which is the hormone that causes hair miniaturization. I believe we have a full-length video on it in the ESI show under lectures.
Just yes. A quick small correction. The serum that we're now infusing, it's based on DHT blockers, not the DHT itself. So we want to block the DHT.
Yes, yeah, that's what I meant.
Natural DHT blockers like sopalameto and caffeine.
I have all of it. Okay. Yeah, sorry for that. Yeah, so we have it. What it does is it causes vascular endothelial growth factors, so blood flow, and we have a lot of active ingredients that blocks DHT. So, for instance, we have corn seed extract, which improves blood flow to the hair follicles. It's a natural emollient that moisturizes the scalp and hair by keeping the hair follicles hydrated and nourished. Rosemary oil, which is essential oil known for its ability to improve cellular generation and blood circulation in hair follicles. NCBI also has a really nice study on rosemary oil, and it has been proven to be as effective as minoxidil, and except it isn't as irritating as minoxidil. So one of our key ingredients is, it's only 0.5 on the scalp, is rosemary, and it is very essential for hair growth. Sage oil, the clary sage oil, it helps balance scalp oils, increases cellular metabolism of vitamin C, which is a powerful oxidant, helps create collagen, which is an important part of hair structure. Hyaluronic acid, which enriches the scalp and moisturizes, keeps the follicles well hydrated. Hyaluronic acid is also known as a natural antioxidant, so it's going to stop or reduce the aging process on the skin. Grape seed oil is rich with vitamin E and linoleic acid, which helps hydrate the scalp and stimulates hair growth. And ginseng extract anchors the root of the hair follicles of the scalp and prevents hair thinning. Caffeine, which is a powerful antioxidant, stimulates blood supply to the roots and blocks DHT. The B vitamin complex, which is the vitamin group for hair loss, it stimulates blood supply to the roots and increases activity of cell around the scalp. Powerful DHT blocker is copper peptide, and it's also very anti-inflammatory, so it's an important ingredient as well. Soft pomelo berry extract is one of the nature's wonders to block DHT. If you ever watch YouTube or anything like that, there's a lot of plastic surgeons in California, and they're using soft pomelo on everything, on their face, on their scalp, and they're working it in with needling because DHT affects not just our hair miniaturization, but also affects how our skin ages. So there's a lot of people that use soft pomelo. It's sort of like the big anti-aging ingredient these days. And biotin, which is derived by grains and nuts, and it is known to boost the production of keratin, and the protein of which hair is made of, and amino acid complex, which is the building blocks of keratin and other proteins, and supports healthy hair growth. So it has a significant amount of ingredients to really augment that treatment and made very specifically for hair. So hair growth. So what is the difference? There's a lot of people out there, and I always get the question, what about PRP and hair growth? Well, PRP is great, and it does help with hair growth. The problem with PRP is going to have the VEGF, and it's going to help with all the blood circulation, just like I spoke to about the face. But what it does not address is DHT, and the DHT is really what's causing hair miniaturization. So what would happen is you'll have a PRP treatment and you'll have some hair growth, and then you don't have a PRP treatment, and then you start shedding again, and it goes back and forth. And PRP is a kind of a nuisance to treat, to be honest with you, because you're always having to spin blood. It's expensive, and they have to have it done pretty much all the time because it is a hormonal issue. The benefit of having the Dermaroller line of products, the Accelerus products, is not only can you do in-house clinic, but we also have the home roller for the scalp and the DHT blocker product to augment that treatment. So it is going to be, your client actually has something to work with at home. So they're going to come in for clinical treatments, and they're going to see a wonderful result. We've had some crazy results with this treatment, and then they can maintain their treatments at home and come in to your clinic and get home care, and they're going to be able to maintain those results later, which is really, really nice. I even know some clinics right now that are selling the home care for takeaway because their businesses are closed, so their clients can't come in for professional treatments, but they are selling the home roller with the serum so they can do themselves at home. So it's really, really nice, and it's a long-term affordable result with this. So anybody that has gone through this type of treatment, it is a really nice service for them to maintain at home the integrity of their scalp and integrity of their hair. So they're going to have an ongoing result with it. It's good for men and women. And there's a lot of women that just use these treatments just to maintain healthy and beautiful and shiny, thicker hair. And so they can have these treatments if you're going through a program and you're going to, really have someone really has issues, they're going to start off doing the treatments maybe once a week until they start to see something, and then they're going to put the treatments further apart, maybe every 2 weeks to even 3 weeks or 4 weeks if they're doing their home care diligently. Some women like to come in just because their hair isn't too bad, but they see it's thinning a little bit, so they might come in once a month for a long period, for a few months, just to thicken up their scalp. And yes, we do see results with this very, very, very quickly. Especially if they're using the home care. Lots of times I've seen results even after one treatment of this. So normally we're selling a treatment of like a package of 8, and they alternate them. And the first treatments, you're doing them close together. And then as they progress, I usually put the treatments a little bit further apart. And they do their home care with that. And that usually is a really great start for somebody that really wants to have a full head of hair again. If someone is doing maintenance, they might do 4 treatments in the spring and 4 treatments in the fall for maintenance for their scalp. Sometimes people are just buying a partial package and they just doing it just because they already have a significant amount of hair, and they just want to add that nice luxury and sheen to it because it's very healthy for your scalp. It is, I see a question here. I see Sigal's blowing Moshe's scalp all over. We normally just do the crown. Moshe has thinner hair than most, he has a larger area. And so we're doing wherever it's thin, but it's typically just the crown we're doing it. If someone has longer hair, normally I really use just a hand spray. The hair has to be washed before we start. Obviously, if he's already showered, I would just spray it with alcohol and wipe it down. I like to have the hair quite wet with alcohol and just wipe all off the excess so it's damp. So it makes it easier to drop the liquid onto the scalp and work it in. If someone has longer hair, I don't find it really unnecessary. Like I find it still very easy to provide the treatment. It does not tangle the way you would think it would. And in some cases, I use one of those, stainless steel long combs that you can disinfect. And I'll just sort of, if it's a woman with longer hair, I'll just do like sort of a part and run the needle, the tip along the part. And I just do that back and forth, almost like you're coloring somebody's hair. And I do those. It works out very, very nicely, and you just work until the whole ampule is done. If someone has a follicle issue, this is something that has to be repeated. It's not going to, even if they have, like, they're really impressed and they have a full head of hair, which we've seen with some of our clients, it's something they're probably going to have to do annually, which is great for a clinic because it's repeated treatments. And it's great for them because there isn't a lot of other programs that are as affordable as the eDermaStamp Accelerus hair growth program.
Sigal, can you bring me the hair lotion? I want to show it. Katie, one word about the full protocol of the hair growth. We have an open bottle there.
Okay.
So.
Yes, they have the hair lotion they use at home. You use it every night, but every second night you use our roller with it, and that's their hair program.
Yeah, so for hair, for home maintenance between sessions and after the 8 treatment protocol has ended, this is what the client uses between at home. The hair lotion should be applied every day, every night before they go to sleep. And approximately twice a week, combine it with the home care roller to increase the infusion of the ingredients. The hair lotion has all the vitamins, the nutrients, the ingredients that stimulate the blood circulation in the scalp, but also the DHT blockers. So this is something that if they use on a daily basis will help to keep the results for a longer period of time, because we have to keep on blocking the DHT if we want to prevent the hair from start thinning again. So this is the...
and again, also at home, we are treating the crown, because on the crown, we have the DHT receptors. If you pay attention, you see the hair on the side and on the back stays intact. The main problem is the crown. So this is a typical hair loss pattern, because here on the crown, we have the DHT receptors. So, and the DHT is our enemy when it comes to hair growth.
And this is the hair growth kit. It has 8 vials in it, 8 ampules. 4 of them are called hair repair. This is the DHT blockers. And 4 of them are called skin rejuvenation vitamin. This is all the nutrients and the vitamins that we infuse to the follicles. So we alternate every treatment. One time we use the hair repair, the other time we'll use the skin rejuvenation, and so on and so forth. The intervals between treatments is about 2 weeks. You can do it every 1 week, but not shorter than that. So between 1 to 2 weeks between treatments in clinic, and again, at home, the client uses the hair lotion.
And one more word before we finish. This treatment is not painful because we go only 0.5 millimeters. So I barely feel it.
I want to show the redness.
Yes.
A little bit of redness, yeah.
So we don't use any numbing cream, and the treatment is quite comfortable. This is maybe the first time, like waxing, first time you feel it, second time you don't feel it. You feel it mainly when it goes to the hairline or to the vortex. But generally speaking, this is very comfortable and short treatment. This is 10-15 minutes and you're done, because you don't have the numbing and you don't have the mask and all the other stuff.